Hello, hello, and welcome to today's episode of Physicians Fame Podcast. I'm your host, Dr. Erika, your IMG mentor, and today we have a very distinguished guest with us. We have Özlem. Hello, Brian.
Nice to meet you.
Hello, hello. Thank you so much for being with us today, Özlem.
Thank you so much for having me today.
So, Özlem, do you mind sharing a little bit more about yourself?
Sure, absolutely. So my family is from Bulgaria. They've immigrated from there. I was born there as well. I am the first one to go to school here in the United States. So it's been quite a journey, learning how the culture works, how to be a student here in the United States, and adapting to the system here.
Wow, no, that's amazing.
Yeah.
And so from Bulgaria to here in the States, what have been some of the differences that you've noticed, if you don't mind me asking?
Sure, absolutely. Culturally, it's a big difference. Back home in Bulgaria, we're very open and friendly, and everybody knows everybody in the village that I'm from. Here, I found that I'm a very talkative person, right? I love to talk to people. I love to interact with people. And I find that when I do that here, people kind of take a step back and they're kind of like, okay, why are you talking so much to me? So I think that's been one of the biggest things that I've been facing. In terms also, another thing that I find difficult for me is actually language. English is my second language. So sometimes conversing in English can be difficult for me because I translate it in my head from Turkish and Bulgarian out to English. So that's been one of my setbacks.
Yeah, no, honestly, I think your English is amazing. Your English sounds amazing, honestly. And you mentioned you also speak Turkish?
Yes, I do fluently. Yep.
What other languages?
Bulgarian as well.
Wow. And so did you learn both Turkish and Bulgarian from childhood, or was it one first and then the other? How did that happen?
Both of them together. At home, I didn't really go to school. It's amazing what children can do. I learned both of them at home. I learned how to read and write in Turkish at home. And then English, when I came here, I had to take English as a second language for a couple years. So that's how I learned that.
Wow, no, that is so cool. I love that. And, with all the learning that you're doing and, the fact that you are transitioning over, it's really just been a lot of new experiences for you.
Yes, it has been.
How did you, if you don't mind me asking, from being on the other side of the world to here in medical school, that's amazing. I love that. What inspired you to attend medical school?
My grandpa.
Really?
So my grandpa is a village doctor back home in Bulgaria, and he was practicing in Turkey too during his time. But after he retired, he came back home to the village, and he still continued to see patients. We have people just coming into our house and knocking at the door, as if it's their own home, and he treats people and people go home smiling, and it touched me truly, like watching him heal people. He was my inspiration to go into medicine.
Oh, that's amazing. Wow. And so you all live together and everything, and then
yes,
people just knock at your door.
Yep.
I am sick.
Yes, no, exactly. And he wouldn't turn anybody back. Everybody's welcome. If we're having dinner, they can sit at the dinner table with us.
Oh, no way.
See, that's where the cultural difference happens here, right? Because here there's lots of boundaries, right? You don't just call your primary care physician like, hey doc, I have a cough. Can I come see you real quick? Whereas over there, yeah, you can absolutely do that. They know my grandpa by his first name, and it's a very personal connection.
And that's essentially what you would like to do as a physician.
Absolutely,
too, right?
Yes. I'm very passionate about kind of getting rid of the traditional 15-20 minute patient interactions that we have here in the States, and turning it into more of how can I say this? Like a trust experience. I want patients to be able to trust me when they're sitting across from me. I want them to feel comfortable, I want them to feel heard and valued instead of rushed. So those are the changes that I'm hoping to bring into my own practice when I'm done with my schooling as well.
Wow, that's amazing. And so I think based on your response, you're pursuing possibly a private practice then?
Yes, that is the goal. I've been in a hospital setting as well. I've personally worked for a private clinic, but also doing my rotations in a hospital setting. There are differences in both, but I feel like having a private clinic would be ideal for me.
Yeah, more in tune with your goals.
Absolutely.
And what specialty, if you don't mind me asking?
OBGYN.
Oh, I love
Yeah.
that. Nice.
Yes.
And what made you choose that?
A mentor that I had here in Chicago, actually.
Really?
Yes. Definitely wasn't going that route. Yeah.
What were you initially trying to pursue? Like, what happened there?
Right. Family medicine.
Yeah.
I was really interested in family medicine, following in my grandpa's footsteps. But then when I moved here, I had a very wonderful mentor, and he changed my views on what I wanted to do. So I think that's where I'm headed now. That's where I'm headed.
No, definitely. I'm rooting for you also. I think it's so amazing. It's such a great pursuit.
Right.
You know, catering to those patients. What made you do the jump specifically with your mentor?
I saw him interacting with his patients. Now, being a woman and going to the OB-GYN for, evaluations or when you're pregnant, it's a very sensitive thing to do.
Right.
You have to be able to trust the doctor that's seeing you. You have to feel like you're being cared for. And he really showed that to me, and made me kind of unlock my own abilities. I feel like I'm very empathetic, very caring, and he helped me unlock my own abilities to do that.
So you just really awakened that in you.
Yes, absolutely. He turned on the switch.
No, that's amazing. Good. And that was during rotations, right?
Yes. Yep. A few months ago.
Really?
A few months ago. Yep.
Yeah, it's so cool. I think it's so amazing seeing that recent transition.
Yeah.
That is
absolutely.
That is so amazing, and I think that's such an amazing part of the medical school journey, of the medical experience, right?
Right. One of the other things that I'd like to add to that is I have a very close friend of mine, and she's an African-American female. She just delivered a healthy baby girl.
Okay.
And she's doing great now, but her pregnancy was very complicated. During her delivery, she was sort of unseen, unheard. Her pain was minimized. She had a very difficult delivery. And what happened with her was she faced a lot of severe health complications because of the bias that exists in our healthcare system. So speaking with her about her delivery and, day to day, she tells me like, oh, I'd love to have another baby, but I'm afraid to. And so I started doing some research looking into that, and I found that actually African-American females have a 3 to 4 times a higher rate of dying during delivery as opposed to somebody who looks like me. And I think that this is, a big problem that needs to be solved, addressed. Yeah, absolutely. So I feel like I can make a difference.
No, definitely.
In that community.
No, and I think it's great that you're really attentive, not just to the patient, but again, just the overall population.
Yes.
I think that's what makes such an amazing physician.
I agree.
And again, I just think it's so amazing how part of the medical school experience, both within rotations, outside of rotations, all of those, it's almost like a movie, everything that's coming together, right?
Right.
And those are essentially what are building your passions.
Absolutely, yeah. I've been kind of learning or hoping to implement that us as future physicians will be able to ask our patients, instead of, what's wrong with you? We want to be able to ask what's happening around you. What are the things that are affecting you, and how can I make your care better, instead of addressing, one little thing that you did come in here to see me for.
Right. Just like in and out, okay, bye.
Right. Exactly.
Yeah. No, definitely. And if you don't mind me asking, what are are there any other passions that you've kind of been developing throughout your medical school journey?
Yes, I've been kind of developing a passion for mental health and mental health awareness, especially in cultures like my own, because it's such a stigma, right? So I'm hoping to kind of, I want to do a little bit more work on that.
No, definitely.
Because it is, it goes unnoticed. It really does go unnoticed, and people do suffer in silence. And, it's such a big stigma where I come from that even talking about it, like immediately, if you bring it up, it gets shot down. So that's another interest that I've been kind of building. And
no, definitely. And I think that's a very important topic, universally.
Absolutely, I agree with you.
But it's also very prevalent throughout medical school.
Yes, absolutely.
Could even carry over through residency, your practice. And so definitely tackling burnout is probably something, that you really like to address.
Yes, I would. It would change the outcomes for not only us as physicians, but our patients as well. Being able to balance our time and taking care of ourselves as well while we're taking care of others would make a huge difference.
Yeah, definitely. It would definitely reflect on the treatment of the patients.
Oh, 100%. Yeah, 100% it would. It would.
No, definitely. And I think, again, it's just great the fact that you're going in with so much passion.
Yeah.
I really love that, and I commend you for that, Aslam.
Yes.
That it's not just one passion that you have, but it's multiple ones. It's a very multifaceted passion that you have towards healthcare that, is not even directed to the patients.
Yes.
Conventionally people think, I'm a doctor, I'm taking care of patients, but you truly are looking out for everybody here.
Yeah.
Not just the patients, also the healthcare professionals, the medical students. It really is a lot of, there really are a lot of things that you're tackling right now for medical school.
Right. I mean, we're all a team. We all work together. We have to look out for one another. I don't see medical school as a competition. Am I going to finish first? Am I going to be better than you? Am I going to make more money than you? None of that. I think in the future we all have to be able to work together. I want to be able to call up my colleague, hey, we went to medical school together. I have a patient I'd like to consult with you on. I want to be able to do that comfortably.
Yeah. Just have that, that dynamic and relationship with your colleagues, very similar to the one that you would have with your family as well,
Exactly.
right?
Exactly.
Yeah, no, and speaking of family, you have a very close relationship.
Yes, I do.
With your family and everything, right?
I do. I have a brother. He is 24 years old, and I love him to death. He's inspired me a lot through this journey. I've had a lot of setbacks in my journey, my personal journey, and he's helped me get through a lot of them. We're very close. And my parents, same thing, they definitely sacrificed their own youth and their own lives in order to give me and my brother what we deserve.
Yeah, no, definitely.
What we deserve.
That's truly commendable.
Yeah, absolutely. I love my family.
Yeah, my praises to your family.
Yeah.
Because, I feel like what they're doing, in addition to what you're doing, those impacts are trickling over to future generations.
Absolutely. I agree. Absolutely.
And is there anything else that, is there somebody else that you lean on during medical school? Aside from your, brother?
I have a little dog. See?
Yeah.
His name is Ali, and he is, my everything. He doesn't speak back to me, at least not often.
And I'm sure he listens, though.
But he does listen. He knows when something is wrong. He knows how to make me feel better immediately. Like if I'm having a rough day, if I had a tough exam, or I got a result on something that I wasn't happy about, he just comes, wags his little tail, and kind of, makes me feel good. He comforts me. I love him. I truly do.
Very attentive.
Yeah.
I love that. And, if you don't mind me asking, outside of medical school, what other hobbies do you have?
I love to work out. I like to go to Orange Theory Fitness. Do that. I love that.
I'm not sponsored by them at all. No, but it's really neat because you don't have to think of what am I going to work out today?
Right.
What's going to happen? What am I going to do? You just go to Orange Theory
and knock it out. The coaches are great. Working with other people in a group workout is really nice. I find it lets me challenge myself a little bit more because I'm like, okay, they're doing it, so I should be able to do it, or I should be able to run a little faster, things like that.
Everybody pushes each other.
Yeah, I absolutely love going to Orange Theory. I'm from Jersey originally, so when I'm back in Jersey, I do work out with a trainer, and he's changed my life in so many ways as well. So that's something that I like to do in my free time.
No, that's amazing. I love that. And you're really stylish too. I love that. That's some of the coffee of yours, right?
Yes, I love to get dressed. It makes me feel good. Even when I go to take an exam, I don't show up in sweatpants. I don't show up in pajamas. I will have a full-blown outfit on as if I'm going on a date. Yeah, and that's how I take my exams. It just makes me feel so much better about myself.
Just really putting your best face forward.
Absolutely.
Absolutely. In and out of the clinic. I think that's so amazing, Aslam. And I really love how, all of these different aspects of your life, from family, to fashion, to Orange Theory, all of these, if you notice, they're little bits and pieces that are having an impact, again, on the patients, on your colleagues, and you're just overall, fostering, the change, a really positive change in healthcare overall.
Right, and that's my goal, I'd like to change patients' lives. I want to touch their lives. I want them to be able to trust me. I want them to be able to call me, email me. If you're able to form that relationship with your patient and make them feel valued, they're more likely to listen to you. They're more likely to, participate in preventative care. And overall, in the long run, what happens is it gives you a better healthcare outcome.
It'll be a benefit for everybody.
Absolutely.
I love that. Absolutely. I really appreciate your time. Thank you so much for your insightful responses. Again, my praises to you, your family, all the impact that you're having in healthcare. I'm wishing you all the best, and definitely keep me
so much.
posted.
Absolutely. Hopefully we'll get to meet together sometime again.
Yeah, colleagues in the future. And
absolutely. I agree.
Thank you so much. Again, awesome. Thank you to everybody who tuned into today's Physicians Fame podcast episode. Once again, don't forget to stay connected, and we'll see you on the next one.